Hello, my name is Spencer Natelli, and in this presentation I will be going over my healthcare system design. So in this healthcare system, insurance companies will be private, non-profit. They will also be providing a universal basic plan by working with the government and doing a mandated plan. They can provide supplemental plans, which include individual and family plans, at their own premium in order to gain additional profit. They will also compete with other insurance companies in order to create a free market in the healthcare system, and they may receive incentives for providing quality care each year. A competitive market of private insurance companies can create a free market for health insurance companies that provide more choice and lower prices for consumers. Excess profit made by the insurance companies can also be used to moderate premium increases in the following year. The insurance company system is also designed to combat increasing concentration in the health insurance market, which are linked to rising prices and falling quality. In previous years, concentration has risen from 65 to 77%, and decreasing hospital market concentration would reduce hospital spending by almost $6 billion. In this healthcare system, everyone will be required to have insurance, so the problem of adverse selection is avoided through this. Different segments of the population will also not be governed by different rules. The government provides plans for those who cannot afford if they are under a specific threshold. Residents who do not purchase a plan will receive a hefty yearly penalty until they acquire a plan to enforce this. Residents can choose to purchase a supplemental plan that includes the basic mandated government plan in addition to any other coverage they wish. In 2020, 28 million people did not have insurance. Based on the graph from 2018 and 2019, younger people tend to not have insurance compared to older people. A universal coverage system would fix this by requiring insurance for everyone and could also increase the risk pool. This healthcare plan will be financed through taxes, co-pays, deductibles, premiums, and co-insurance, and it will also involve subsidies from the government to give those who cannot afford plans an insurance plan. Individuals will pay a monthly premium and are also required to pay for co-pays, deductibles, and co-insurance. Elective medical care will be a higher out-of-pocket cost than emergency medicine to recuperate for lost profit. Companies will be required to pay for a portion of their employees' insurance if they are on a company plan, and a portion of the taxes collected by the government will be used to fund the plan. A portion of this taxes collected will be distributed to insurance companies as incentives for performance. So financing will largely be similar to how financing is currently done in the US for the healthcare system. Major difference is the voluntary insurance spending will now be compulsory insurance spending, and also the risk pool will be larger since there's universal coverage and will compensate for lower prices. Like the insurance companies, hospitals will also be nonprofit, and prices will be regulated to some extent by the government. Specific regulations for expensive emergency care and life-saving medications will be in place. The government will also assess prices each year and adjust as necessary. Additional prices can be regulated through discussion between the hospitals and insurance companies. Some of the drawbacks of this are you run the risk of losing profit since expensive treatment will now be regulated. Hospitals can also increase prices on non-regulated treatment, which leads to higher costs. And also, hospitals will be able to use a charge master, but the charge master will have to be regulated and approved by the government to some extent to avoid price gouging. By regulating hospital prices, expensive treatments can be more affordable for patients. Increased price transparency could also reduce spending by $9 billion. Money can be saved and funneled back into medical services and can be used to also provide incentives for physicians to continue providing quality care. Setting prices at hospitals could reduce spending by almost $62 billion and lead to nearly a 7% reduction in national spending. Pharmaceutical prices will have to be regulated by the government to set a maximum price and prevent high costs, especially for big brands with low competition. Pricing will be set yearly by working with government, pharmaceutical companies, and physicians to determine what is fair and what is affordable for consumers. Some of the drawbacks of this are that the profit from insurance companies will be limited, and this could affect negotiating power between the pharmaceutical companies and the government if agreements can't be reached on in pricing, since pharmaceutical companies can afford not to make deals with the government in this instance. The justification for regulating pharmaceutical prices are drug prices don't need to be as high as they currently are, Lowering drug prices can encourage Americans to pursue other forms of care that were inaccessible to them because of the price. Nearly 3 in 10 American adults didn't take any of their prescribed medicines in 2019 due to the cost, and a report from the House Oversight and Reform Committee found from 2016 to 2020 a significant portion of R&D spending was devoted to suppressing generic competition from other drug companies. This money could instead be used and funneled back into the healthcare system to once again provide for incentives or to provide for other medical services. Physician compensation will also be regulated. Instead of being a fee-for-service model, they will be salaried. The salaries will still be competitive, but they won't be as high as a fee-for-service compensation. Like ACOs, physicians will receive yearly monetary incentives based on performance and quality of care. And also, malpractice insurance will be covered by the physician, the government, and employer if applicable. They will pay out of pocket, but the employer will pay a set percentage, and the government will provide subsidies based on the physician's performance, which can help pay for malpractice. Physicians are consuming approximately 20 to 25% of total healthcare spending, so too much money is being spent on the fee-for-service model, and it causes low-value care to improve compensation, protect themselves from malpractice, and sometimes they also follow patient opinions. Salaried compensation will incentivize physicians to provide less low-value care, since they will no longer be receiving payment for services they provide. Money saved from physician compensation can also be funneled back into the healthcare system for medical services or other incentives. There were some considerations taken into account. Healthcare spending and costs, healthcare quality, and patient welfare and equity were all major concerns when designing this system. The goal is to provide a universal coverage with affordable care while also maintaining quality. This is done by providing subsidies and incentives in the appropriate areas. In this system, equity is likely to go up because government is providing more health care and stepping in. Efficiency will go down since higher prices are less efficient. Since the government will be stepping in, prices are likely to go up for the insurance companies and hospital prices. The regulations on these prices will help combat the efficiency issue, though. There are some drawbacks to this system. Major drawbacks include regulation of pharmaceutical companies and regulation of physician compensation. Regulating drug companies could affect negotiations on prices and supply. Physicians feel undercompensated also, even with increased pay, so reductions in compensation could lead to issues with physicians and the supply of physicians. The pros outweigh the cons, though, since universal coverage will increase the risk pool, which will also increase frequency of medical use to cover for regulated costs. Incentives for physicians can also help with the compensation issue. The policies are intended to work together and do not conflict with each other in order to mediate some of the drawbacks with the system. This concludes my presentation, and thank you for listening.